Good morning. Again, I'm Blake Johnson. We're going to take a shift here from talking about cranial nerves yesterday to looking at imaging evaluation of CNS infections. Of all the categories of disease that we can consider in the central nervous system, this is a very important one for us to be pretty facile at recognizing quickly, because in this case, time is definitely essential, much more important than many of the other categories of disease where you really aren't on a window. I mean, certainly trauma and cerebrovascular disease are in that more acute event, but these are fairly acute as well, and many times the time to treatment will affect the patient's outcome significantly. So it's important for us to be aware of some of the specific signs of certain infections that affect the CNS, and also be aware that there are a lot of non-specific sequelae that can impact the imaging appearance of CNS infections. There are a number of deaths worldwide due to CNS infections, which again are often responsive to therapy if we recognize them and institute that rapidly. And we'll look at some of the manifestations here this morning. Now, a lot of factors now globally affect our increased risk for acquiring these. One of them is increased exposure through trauma, more surgical techniques being performed. Travel and immigration is a huge one, and also decreased immunity for a number of factors. On the travel and immigration side, if you know, here's a travel map, a global travel map showing you the pattern, the flight patterns. These all represent flights, and if you see the animated version of this, you can see the migration of all these dots of light, a million points of light, if you will, all over the globe. And because of this transit of individuals across the globe, we do have increased exposure to agents that are not endemic or even present in certain geographic areas. On the immunity side of the equation, we have immunosuppressed patients from either medical conditions or chemotherapeutic protocols that suppress immunity in order to suppress the response to certain organs being transplanted or other types of therapeutic regimens. We have, again, a number of chronic diseases or treatments that can affect immunity and result in an increased propensity to acquire these infections. Now, if we look at the categories of CNS infections, we can think of it in terms of the agents that cause those infections.